Hi, as some of you know that I began my work in this field in an addiction treatment center, and it was one of the only treatment centers in Canada at that time that really understood addiction as a symptom of childhood trauma. We didn't have all the words for it back then, but that's really what we were exploring and helping clients understand. Since then, all the research is showing that 97% of people with drug and alcohol addiction disorder have complex trauma from earlier in life. And so it's that core issue that the addiction is actually the person is using it to try to solve their pain, their emptiness, their inability to escape this very difficult life and find some pleasure. And so what I have done over the years is just worked with thousands and thousands of people struggling with addiction, not just chemical addiction like drugs and alcohol, but process addictions like gambling and food and sex and porn and shopping and all kinds of other addictions that release the same chemicals in the brain that drugs and alcohol do. And so one of the big things for people going through addiction recovery is not just dealing with their complex trauma, but actually dealing with the addiction itself. And so they go through what we refer to as the initial withdrawal stage or acute withdrawal. And so that can be going through the shakes, that can be going through just being very sick, diarrhea, vomiting, flu-like symptoms. And so that withdrawal period typically is a week, 2 weeks, that you go through this very intense acute stage of withdrawal. The danger that many have is to think that they're through withdrawal, then they're good. They're ready to go into recovery and now they can just work on themselves. What they don't realize is that there's what is known as post-acute withdrawal syndrome, or PAWS, P-A-W-S. And so it's the next stage of recovery. It's less dangerous as far as physical detox symptoms, but there's some more persistent, lingering issues that many people are thrown off by, they're not prepared for. It affects their mood, it affects their emotions, it affects their physical stuff, it affects their thinking. And so what I want to just do in this short video is give you some of the characteristics of post-acute withdrawal syndrome. So if you're going through withdrawal, here's what you can expect for up to 2 years as your body begins to change after it adjusted to all of the chemicals that were happening in your brain. Now it's trying to adjust back to normal again and to heal all the damage that was done. And so how long the pause goes on really depends on the substance that you use, the type of addiction, how long and intensely you were in that addiction, whether there's co-occurring mental health issues, how bad the trauma is, and then your overall health and support. So all of those play a part. They're factors in kind of how the pause symptoms are going to work out and how long they will continue. But it can continue for some up to 2 years. And so again, what is happening is because of the process or chemical addiction, you were causing extra dopamine, serotonin in the brain. And the brain developed a tolerance. It adjusted because it's not used to those levels. Those aren't the normal levels. So it starts to adjust. It changes in order to not be kind of ruined by those chemicals. And so you develop this tolerance. And so your whole neurotransmitter system is unbalanced. Your brain stops producing dopamine, serotonin in its normal ways. And a lot of your neural pathways that were there are atrophied because you've been putting in all of these extra chemicals and synthetic chemicals. And so it takes a while for the brain to readjust and rebalance and heal, and that shows up for up to a couple years. So the first thing I want you to understand as we look at these symptoms is when you get to this post-acute withdrawal, your symptoms can come in waves. And so you often feel like you're on a roller coaster. So in the beginning, you can get symptoms minute by minute and they change hour by hour throughout the day. It's just up, down, you're here, there, and you don't know quite what's going on. It just feels very wrong, very weird. You feel out of control. But then over time, you can go for a month without any symptoms and you think, oh, I'm finally past this. And then they're back a month later and it throws you for a loop. And so it's just to be aware that there's certain patterns that have been kind of charted as the research has been done. But it is a roller coaster. It can ebb and then come back again. And so just be very aware of that. So let me give you generally what the symptoms are, and then I'm going to do the timeline, the first months, etc. So emotionally, many people in this pause time, there's just increased irritability, get angry very quickly, or they just struggle with depression, low motivation. That's just a constant for them. Many have extra anxiety issues, even panic attacks, mood swings from feeling great to feeling depressed. That's common. Some have what we call anhedonia, and that is just zero pleasure. You're just emotionally flat. You don't feel, you just feel robotic, numb. Others, there's just this overreaction, dysregulate very easily. And stress is often a big trigger of that. And then for many, there's just guilt. As you're starting to think back on all the stuff that you did in your addiction, so guilt becomes this constant companion. And then because you're not medicating all your emotions now, trying to freeze them out, you're now starting to feel emotions that you haven't felt for years. Weird emotions, emotions that sometimes you don't even know the name to. And that's just really, really difficult. And then cognitively, there can be brain fog. You just feel fuzzy in your brain. You have difficulty concentrating. You have memory problems, especially short-term memory. And that causes you to have trouble making decisions, and you don't think as quickly as you have in the past. There's just like a slower processing speed happening. And then you can find yourself in repetitive thinking, that your brain spins or you obsess on things and you just can't shake it from your brain. And then some physical symptoms is you can have sleep issues, insomnia, vivid dreams, very restless sleep. Often you just feel very tired, chronically, low energy all the time. Some go through physical coordination issues where they just feel clumsy. They just not coordinated as they used to be. Some go through increased sensitivity to pain. And then others experience intermittently drug cravings that just hit them out of the blue. So those are the kind of the overall symptoms that you'll be going through. Now let's break it down by month. So in the first 2 months, that's when your brain does the most of its recalibrating. Your dopamine and serotonin systems are still out of whack. And so this is when you get the mood swings the worst, the irritability the worst, the anxiety and restlessness the worst, the insomnia and vivid dreams the worst, chronic fatigue the worst, and the brain fog. So key in recovery in the first 2 months, just really focus on developing a structure in your day, a routine, so you can just get through the routine and it kind of does a lot of the work for you. Make sure you have good sleep. Make that a priority. Avoid high stress situations as much as possible. You can't avoid them all, but you can avoid unnecessary ones. And make sure you do physical movement activity every day. Yoga, walking, dance. But that will help with the brain chemicals. So now months 3 to 4, besides your brain still healing, often what's also happening in this phase is some of the honeymoon of recovery is starting to fade. So initially recovery, you get all these good positive things happening. It's exciting. That starts to, the honeymoon's over. Now you're settling into this is a lot of work. It's going to take a lot of time. So there's not the same excitement about recovery, which just adds another negative that you're dealing with. And so this is where people can really struggle with depression stuff, and that anhedonia is still going on because your brain hasn't repaired all the dopamine properly and you just feel very flat. You can still have moments of cognitive difficulties. And if you get stress, you can all of a sudden dysregulate or get cravings because your brain wants to go back to not feeling. Be prepared that you're still going to have times where you're just frustrated that you're not feeling normal yet, that this is taking so long, that you're not fixed yet. So in your recovery, focus on really strengthening your supports. Make sure you get to meetings of support, have therapy, have mentors and accountability partners. Really pour a lot of energy into just a surrogate family, building that connection with healthy people. Work at keeping your expectations realistic, that this is not going to be a quick fix, an easy fix, that this is going to take longer than maybe you first expected. And make sure you continue with your healthy routines. And on good days, don't stop doing the things that got you feeling better. Now months 5 and 6. So your brain is really starting to heal, but your emotional regulation is still up and down. And so you can get triggered unexpectedly. So you can have a lot of good days now, but then triggers hit you. And when those triggers hit you, you go to irritability really quickly. You dysregulate. You can have some memory lapses because your brain's still healing. You get on and off fatigue with that. You can all of a sudden just feel exhausted after a trigger. And then what you realize is there's still a sensitivity to stress that's behind all of these triggers. So in your recovery, once again, focus on building emotional regulation. Breathing exercises, daily meditations, mindfulness, things that help you learn to regulate your emotions. Learn to meet your 12 needs. Learn to talk about problems as they come up. And then what you're doing through this is you're identifying all the times that you're most high risk and developing a plan for, okay, what do I do when I visit my parents? What do I do when my mom calls? What do I do when my children do this or my partner does this? And you're beginning to get to your cortex and think through a plan that you can implement so you don't just react. And many people find it helpful to kind of track their symptoms a little bit so that they can see the ups and downs, but the general overall improvement happening. Now months 7 to 9. So now you're getting more good days than bad. So that's very positive. You're growing in your ability to regulate your emotions, to manage your stress, but you still get these unexpected emotional dips. So you can still get some depression and anxiety, some fluctuating motivation. Some days you're motivated, some days you're not. And your stress threshold still isn't what it used to be. So those, just to be aware, that's still going to be happening. So you, in recovery, you just keep focusing on getting healthy physically, getting your brain healthy, good exercise, learning, nutrition. Staying involved in recovery groups and in therapy is so important, and working on deeper issues, not just symptoms now. You're now wanting to get to the trauma, to the shame, to who am I, those very core things. Then months 10 to 12, pretty stable most of the time, but the symptoms still resurface during stress, anniversaries of loss, anniversaries of major events, or major life changes today. You move, you get a new job. All of those things that put you into the unknown, they can re-trigger everything. And so you can go back to mild brain fog in those times, sleep disturbances in those times, irritability in those times. So again, in recovery, have a solid plan in place for what you're going to do in those times. Your recovery starts shifting a little bit from just focusing on your own healing to now learning to love others, learning to support others. And that becomes an important piece in this time. And then 2 years and beyond. So you basically, the nervous system is healed, the brain is healed, but high stress situation, major changes can still trigger. And that's so important to understand. And so high stress, major changes, and you're back struggling with all of the symptoms again. And so it's important to realize that even when you get to a point where you're feeling really good, you don't drop the routine, the support system, the therapy, the things that helped you heal, the things that are going to help you stay on track. Stay connected to healthy people. Don't, like many do, start going back to old friends, to being just with a toxic family again. No, create a healthy life. Stick to a healthy life. That is so important. So I hope you see why this is so important to understand, because the danger for many people is they go through treatment programs, they get past acute withdrawal, they get past the first few months and they go, okay, I'm good now. And then when the symptoms hit a few months later, they go, oh, I guess I didn't change at all. I guess there's no hope. I'm too broken. And they just go backwards and they feel hopeless. No, this is just part of the body healing. It takes a long time. So realize that. Be patient. Don't jump to the conclusion that you're doing something wrong or you're too broken. Be prepared, though, that you can be doing really well, and then all of a sudden, when you get a high stress or a major change and the symptoms are back, you can go back to, you haven't craved your drug for a year or two, and all of a sudden you're craving your drug again, and your brain is thinking just once, I can handle it now. I haven't done it for 2 years. I think I could handle just doing it once, and you can talk yourself into a relapse. So be aware of that. But also be aware that as you're going through PAWS, all of these symptoms over 2 years, those closest to you are also going through what you're going through. And it's putting a strain on the relationships. It can be doing damage to your relationships. It can be affecting your job. And so the more you understand it, the more you can help those with you understand it, and the more you can have plans in place to prevent you or help you not act out when you're triggered in ways that hurt those that you love. So, summarize, in those first couple of years, stay consistent with your sleep, your exercise, your diet. Psychologically, get therapy. Do things that help you regulate, grounding, mindfulness. Have a structured daily routine. Get into support groups. It is so important. Connect and communicate with safe, trusted people. Set boundaries with unhealthy, toxic people. So remember, PAWS is a sign of healing, not of failure. PAWS is your brain rebooting itself, and it takes a long time. So be patient with it. Be prepared for good days and bad days. That's all part of this. Don't get discouraged. Thank you.